For some coronavirus patients, their battles with the disease continue on for months. They're unofficially being called COVID-19 long haulers. Long haulers. Dr. Scott Krakower is one of them. Dr. Krakower is a psychiatrist who still has symptoms 2.5 months after being diagnosed. He was treated by E.R. Dr. Robert Glatter at Lenox Hill Hospital here in New York City. Good morning to both of you. First of all, Scott, let me just start with you. How are you feeling this morning?
I'm feeling okay this morning.
But not well enough. You're not at a point where you can go back to work, though.
No. I mean, the days have been, each day is like, different. Some days are up, some days are down. I would say the mornings are better for me. And then by like 1 or 2 o'clock is when my voice and my shortness of breath kick in more. And then it's harder to do things.
If you could, take us back to April. I mean, not only were you working in a hospital, you had a newborn and a toddler at home at the same time as well.
Yeah, it was really hard for all of us as a family. Back to April, is when I first got sick. And at that time, I actually lost my sense of taste and smell. And I actually thought maybe it could be sinus or it could be something else. And then before I knew it, everything just started to spiral, downhill after that, where I started coughing more and more profusely to the point that eventually I couldn't swallow, and it was just getting really bad, and I ultimately wound up hospitalized.
Scott, have the doctors told you whether you're going to improve, and if so, when?
No one gives you a definite, clear answer. I mean, the one thing that I feel good about is that I feel good that every week that's gone by appears to be better and better for me. And so I'm optimistic, and I think I've always maintained that sense of optimism despite everything that we've been through as a family, that it's going to continue to get better. That plus all the support from my family, my friends, and my colleagues, I think all definitely kept me going through this entire time.
Dr. Glatter, who's with us, as I understand it, prescribed a drug called Dexamethasone. It's a steroid that's typically used to treat inflammation. Has it helped you, Scott?
Oh, yeah. I mean, I'll go back in time and say before all this even came out, after I was actually getting worse and worse, and I was very short of breath. Couldn't talk at that point. And again, like I said, I was having trouble swallowing, and at one point nearly aspirating. And when I showed up to the ER after getting the IV steroids, I would say that I had pretty significant improvement within the next 24 to 48 hours, to the point that actually my family and friends even commented, wow, you're actually like much better. Like you're almost like yourself. And then it kind of, it lasted about like a week. And then at that point it started dissipating again, but that's because the IV I think had worn off. But yeah, if it wasn't for that IV, I really don't know where I would be right now. And for Dr. Glatter.
Dr. Glatter, let me bring you in here. These so-called long haulers. What is this? I mean, is this something that's unique to coronavirus, or is this something that you've seen before?
Well, long haulers have actually been described before, and actually we saw this with MERS and SARS. And in fact, up to 40% of patients that had SARS in 2003 exhibited these chronic symptoms. And what we're seeing is that this is a byproduct of the inflammation from the virus itself. In other words, dead fragments of virus elicit an immune response. And as a result of this, the body reacts and produces certain types of substances that can really have adverse effects, and what Scott is describing to the audience.
This dexamethasone that's typically used for allergies primarily, as I understand it, is it now being used more frequently for COVID patients?
Well, it's not approved for that use. There was one trial in the UK that looked at this, and certainly there was advantages for patients who were on mechanical ventilation and people who needed oxygen. But those with mild illness didn't really derive any significant benefit. We need to look at more data, continue the trials and see if this may have effects in people with less significant illness who don't require oxygen. But I am encouraged by the data in the trial. Certainly it had, such a significant effect in patients who were very ill. But we're looking for that drug that really has a significant effect in people who are less ill, these patients who are long haulers that you're describing.
Any idea, Dr. Glatter, and again, I know that obviously every case is different, but any idea when these symptoms might start to subside?
We really don't know, and that's the answer. I mean, there are many patients that have gone on for months now, since mid-March, that I've treated in the emergency department that continue to have fever, aches, chills, they're short of breath, they're having chest pain, they're having generalized fatigue, and we call this post-exertional malaise. They take a walk, just up to the store, and they're just so tired they have to get in bed. And that's really what we see with chronic symptoms, such as in diseases called ME/CFS, as well as Epstein-Barr. And so there's a variant here that we need to look at and definitely do more research, which we are doing, and there are trials looking at this.
Scott, I'll end with you here really quickly. As you perhaps know, there's this ongoing debate in our country over mask wearing. What do you say to that?
I mean, I definitely think that people need to be cautious and they should be wearing masks. Just to remember that it happened, and I was relatively healthy. I was like running around, never missed work. And then before I knew it, everything just sort of, over a short period of time, everything got a lot worse. So when I see people like in those other areas and I see them crowding the bars or, just very close together in tight quarters, it really upsets me as a person. And I know my family, because everything we went through, we're just happy that I'm here and I'm alive today and I'm here with my children. And I really hope people, take this seriously.
Yeah. Dr. Krakower, I'm glad you're doing better. Thank you.
Thank you so much.
Continue to improve. And Dr. Glatter, thank you as well, sir.